Hey, what's up, YouTube? What I want to talk about today is working as a male phlebotomist. Now, first and foremost, for those of you who do not know me, my name is Croy, and I am a nationally certified phlebotomist. I have over 5 years' experience as a phlebotomist. I've worked in laboratories, I've worked in hospitals, clinics, and nursing homes. So I do have a lot of experience working as a phlebotomist. Now, with that being said, um, let's get into the actual video. Working as a male phlebotomist. Now, when I first started out and I first got hired, and I seen all those women I was going to be around and working with, I was in heaven. I was in heaven. I was just starting out in healthcare. I had a brand new car, working around all these women, getting a good hourly pay. Man, I felt like that dude. I can promise you that. It was like a honeymoon for me, for I would say a few months. But then things got real, and I really started to notice um, a lot of challenges, a lot of difficulties. So the honeymoon was over, I see, like within 3 months. Um, and a lot of the challenges pretty much came from the patients. And what I mean from that is, it wasn't so much like the drawn blood aspect of it, because, I was very confident in drawing blood. So I was able to excel at that at a very high level, very fast. But the challenges that I faced from patients was this. Let's say me and a female are both, sitting down at the front desk, and a patient walks in. Now, when that patient walks in, whether male or female, y'all both stand up to greet the patient, regardless, if the patient is a male or female. That's what I was meaning. And the patient walks to the window, front desk, and the patient immediately gravitates all their attention, their undivided attention, to the female. They would act like I didn't even exist, like I wasn't even there. And that was a very common occurrence. Over and over and over and over that happened. And it was like a shot to my self-esteem, like a shot to my confidence. There was times where, I started to question myself, like, am I capable of doing this job? I mean, it kind of hurts, man. It does. Especially if, you enjoy your job, like you enjoy phlebotomy. I wasn't, if I was just there to get a paycheck, then it would be different. But, I really wanted to interact with the patients. I really wanted to, draw their blood and try to be effective as possible with my job. But the patients wasn't giving me that opportunity. I mean, they were blatant with it too. They were like, if they would see me just standing there, let's say my coworker was a female, was on lunch, and patient came in, they would actually sit there and wait for the girl to come back from lunch. And like, yo, I mean, you really had to have alligator skin, if you're going to be a male. If you're a male and you're going to be working as a phlebotomist, you got to have alligator skin, man. You got to be able to um, brush this off, because you are going to face this. All right. Now, me, young black man, of course, we know the racism that goes on, this, that, and the third. But, does that play a fact in the medical field? I don't know. But I don't think it depends if you're white, Spanish, Indian, whatever. If you're a male and you're working as a phlebotomist, you will face those difficult challenges. Um, but there is a good side to it. Once you establish yourself, once you have shown that you have a soft hand, which in phlebotomy means that um, you know you draw blood good. It doesn't really hurt the patient. Once you establish that, then word spreads very fast, and then the honeymoon, comes back again. That's when you and a female working side by side, and patients come in and they asking for you. Then you start getting your confidence back up. You start feeling good about yourself, and it can happen. For an example, if you're working in a laboratory, and say this laboratory has an account with a doctor's office, and the doctor's office is right upstairs, and most of the patients that you're drawing are coming from that doctor's office, and you good, that patient, when they go back upstairs to that doctor's office, will say, that guy who's downstairs, he's very good in drawing blood. So they're going to be talking while they're in the waiting room. you know um, Questions going to come up. Oh, where's the laboratory? Oh, it's right downstairs. Oh, when you go down there, ask for the guy. He's really good in drawing blood. So it's really good, when it comes back around. But from the beginning, you will face that challenge. And I think, working as a male phlebotomist, that's the biggest challenge. I mean, think about it. When you go to the hospital, you imagine if there was a male nurse as your caretaker, you know, or your caregiver rather, as opposed to a female. You probably, you know, be a little skeptical, like, are you sure you can do this job? But of course they're qualified. But it's just the fact that we're so used to seeing women. And in phlebotomy is a woman's throne. All right, the ratio of women to men in phlebotomy, from what I've seen over the 5 years, no lie, I would say about 30 or even 40 to 1. About 40 to 1. Yeah. And, it seems weird because usually women, are more ones that's real airy of blood. They see blood, ew, this, that, and the third, and men, more. Men can be leaking from, their ears, eyes, everywhere, and just give me a napkin, I'll be alright. But women to be sitting there screaming their lungs out. But ironically, there's more women drawing blood in the world than men. Go figure. But yeah, so that's my information to you, man. If you're a male phlebotomist and you starting out as a phlebotomist, just be prepared to face that challenge because it's coming.